Alright, this is Pack 365, myself Srija. Today you are going to learn about the disorders of the endocrine glands and also the ICD-10 code classification. So coming to this slide, we have already discussed about what does endocrine glands secrete. So what do they secrete? They secrete hormones that regulate body functions like growth, metabolism and also the reproduction. So when these glands overproduce or underproduce hormones, disorders occur. So this ICD code range E20 to E35, it covers endocrine conditions other than the thyroid and pancreatic disorders. Yeah. Now let's go into the code descriptions given below. E20. So what is E20? Hypoparathyroidism. So whenever a patient is diagnosed with hypoparathyroidism, so E20 code, ICD-10 E20 code must be assigned for this condition. For example, E20.0. So what it is? It is an idiopathic hypoparathyroidism. So what do you mean by hypoparathyroidism? It is nothing but it's a low activity of the parathyroid glands leading to the low calcium levels in the blood. Hypo means low, right? So hypo means low. Parathyroid means parathyroid gland. So ism means it condition, right? Ism is a medical term for condition. So it's a low activity of the parathyroid glands so that it leads to the decreased calcium levels in the blood. So what are the effects of this condition? You can experience the muscle cramps, tingling or seizures due to the low calcium, due to the absence of the needed calcium in the blood. So next, coming to E21 code. E21 code, it specifies hyperparathyroidism and other disorders of the parathyroid gland. So what do you mean by hyper? Overactivity. Hypo means low activity. Hyper means overactivity. So overactivity of the parathyroid glands refers to the hyperparathyroidism. So when excessive parathyroid hormone regulates in the body, high calcium levels in the blood will be produced. For example, E21.0 code. What it denotes? It denotes primary hyperthyroidism. Nothing but it is caused by a parathyroid tumor or gland enlargement. So what will be the effects? What will be the side effects or the conditions that you experience when you diagnosed with the hyperparathyroidism? So they are bone pain, kidney stones and fatigue. Here you can see at the picture at the right side of the slide. So this is the healthy thyroid gland and this is the hyperthyroidism condition. So in this healthy thyroid gland, you can see the gland size and hormone levels are normal. Whereas coming to the hyperthyroidism, the thyroid is enlarged and eyes are bulged, right? So eyes bulging and the thyroid is enlarged. This is the effect of the hyperthyroidism. So why the eyes are bulging? Due to the excess thyroid hormone. Although this image shows thyroid disease, it helps to understand clearly that how this thyroid gland overactivity affects the body function. You can also see the goiter formation here. So bulging eyes, goiter and the enlarged thyroid gland are the effects of the hyperthyroidism. So next, coming to the next code, E22. So what is E22? It's a hyperfunction of pituitary gland. So nothing but it's an overproduction of one or more pituitary hormones. For example, hyperprolactinemia. So what do you mean by hyperprolactinemia? It's an excess production of prolactin hormone. So what happens when excess prolactin hormone produces? If it often causes irregular menstruation or infertility. So you can experience the infertility problems and also delayed periods and also the missed periods due to hyperfunction of the pituitary gland, right? So whenever hyperprolactinemia is diagnosed, so just assign this E22.1 code for the accuracy, right? And next, coming to the code E23. What is E23? It's a hypofunction and other disorders of the pituitary gland. Nothing but the pituitary gland produces too little hormones, right? So hypo means low or less. So this pituitary gland produces too little hormones. So E23.1 is the example for E23. What it is? It is drug-induced hypopituitarism. Nothing but pituitary underactivity due to certain medications. So here you can see, or you can see as a side effect due to some medications, the pituitary gland, it shows underactivity. So what are the effects of this hypofunction or the drug-induced hypopituitarism is fatigue, growth problems and the low hormone levels. So next, coming to Cushing syndrome, E24 code. So whenever patient is diagnosed with Cushing syndrome or whenever the record specifies this Cushing syndrome, so E24 code must be assigned. So what is the example? Actually, what do you mean by the Cushing syndrome? I already discussed about this Cushing syndrome in the previous slide. So what do you mean by Cushing syndrome? It's a high cortisol levels in the body, either due to pituitary or the adrenal gland problems. So example, E24.0 pituitary dependent Cushing syndrome. So here the pituitary produces too much ACTH hormone which overstimulates the adrenal glands. So whenever a pituitary dependent Cushing syndrome is diagnosed, just assign the code E24.0. So you can see the symptoms of this Cushing syndrome or the pituitary dependent Cushing syndrome. You can also experience the weight gain, especially in the face and the trunk. In the face and trunk part, you can see the face changes. You can see the weight gain or the fat gain over the face and trunk, and also high blood pressure and muscle weakness. So coming to the next code, E25. E25, it's nothing but adrenogenital disorders. So what do you mean by adrenogenital disorders? So disorders, the name itself, adreno means it's a medical term of adrenal gland, right? So genital means related to genetical, and disorder. So disorders where the adrenal glands produce abnormal amounts of sex hormones. This adrenal gland is nothing but it's a sex hormone, right? So disorders where the adrenal glands produce abnormal amounts of sex hormones. So this adrenogenital disorders takes place. So these are usually due to the enzyme deficiency affecting hormone synthesis. So what is the example? E25.0. What it is? Congenital adrenogenital disorders associated with the enzyme deficiency. So where the enzyme defects causes excess male hormone production. Due to these enzymes, when enzymes causes excess male hormone production, congenital adrenogenital disorder occurs. So ambiguous genitalia in newborns, irregular menstruation and early puberty and also the infertility are the symptoms of this condition. And next, coming to E26 code. So what is E26 code? Hyperaldosteronism. So what do you mean by hyperaldosteronism? It's an overproduction of aldosterone hormone. The name itself says it's a presence of the aldosterone hormone. So whenever the aldosterone hormone overproduces, this hormone it controls the sodium and potassium balance, resulting in the hyperaldosteronism. So what is the example? E26.1 code for secondary hyperaldosteronism. This is caused by, whenever a secondary is mentioned, you can understand that it is caused by the another condition. It is not the primary cause. It is always a cause. It is always a side effect of the previous condition or the related condition. Okay. So this is caused by the another condition like kidney disease or heart failure that overstimulates the aldosterone production. So you can see the symptoms of this one like high blood pressure, muscle weakness and also the low potassium values. So coming to E27, other disorders of adrenal gland. So what are the other disorders of the adrenal gland? This includes various adrenal problems which are not classified over E25 and E26. So this adrenal gland, it produces cortisol and adrenaline, right? So which control this cortisol? It controls stress response, whereas adrenaline, it helps in metabolism. So this includes various adrenal problems which are not related to the E25 and E26. For example, when coming to E27.1 code, it's a primary adrenocortical insufficiency, which is also called as the Addison's disease. Addison's disease, nothing but this adrenal glands secretes cortisol and aldosterone, right? So when adrenal glands fail to produce enough cortisol and aldosterone, so Addison's disease occurs. So always adrenal gland must produce enough cortisol and aldosterone in order to escape from this secondary hyperaldosteronism. So what will be the effects of this secondary hyperaldosteronism? Fatigue, low blood pressure, weight loss, and also the darkening of the skin, right? So then E28, what is E28? It's ovarian dysfunction. So what is dysfunction? Abnormal function, nothing but abnormal. This means this is the medical term for abnormal. So abnormal function of the ovaries leading to the hormonal balance is called as ovarian dysfunction. So for example, androgen excess. So androgen excess is a male hormone, right? So this ovaries produces, you can also see this in females as well. So this ovaries produces too much male hormones, androgen. So whenever a female reproductive system, whenever this ovaries produces too much male hormones like aldosterone, androgen, you can see the conditions like PCOD. What is PCOD? It's a polycystic ovary syndrome. So due to PCOD, you can see the side effects like irregular periods, acne, and also the excess hair growth mainly on the face. So whenever the ovarian dysfunction is diagnosed, just assign the code E28. And next E29, what it is? It's a testicular dysfunction. So what do you mean by testicular dysfunction? The testis does not function normally. So it affects the male hormone production. So what is the example? E29.1, testicular hypofunction. It is a decreased testosterone production. Testicular hypo means low or the decreased. So decreased testosterone production comes under E29.1. You can experience this low sex drive, infertility, fatigue, and also the loss of muscle mass whenever this testicular dysfunction occurs. So just assign the code E29 for testicular dysfunction. And coming to the next codes. So E30, code E30 to E35, this code of range, they cover rare or specific endocrine conditions which are related to the puberty, thymus function, multiple gland disorders, and also the other unclassified endocrine abnormalities. So E30, disorders of the puberty not elsewhere classified. So what do you mean by it? So disorders of puberty. So what is puberty? At the time of sexual menstruation, sexual maturation. So puberty is nothing but it's a time of sexual maturation. So problems in the timing or progression of puberty falls under the category of disorders of puberty. So this may include delayed or precocious puberty. So what do you mean by delayed puberty? Puberty starts later than normal. Actually, there will be a specific time period for males and females for puberty stage. So puberty starts later over here than normal due to hormonal imbalances or the pituitary issues. So that's what we call as delayed puberty. So if the patient has diagnosed with this delayed puberty, so just assign the code E30.0. So this code helps hospitals and insurance companies to record and process the diagnosis correctly. So next, coming to E31 code. So what is E31? Polyglandular dysfunction. So what do you mean by polyglandular dysfunction? Poly means many or multiple. So when multiple endocrine glands fail to function properly, they often lead to autoimmune diseases. So the body, autoimmune means the body attacks its own glands. So E31.0, it denotes autoimmune polyglandular failure. So this immune system, it damages several glands such as thyroid, adrenal and pancreas. So what will be the effects of this autoimmune polyglandular failure? So fatigue, weight loss, hormonal imbalance and also the immune related symptoms. So coming to next code, E32, diseases of thymus. Disorders involving the thymus gland which helps develop the immune system during the childhood. So thymus gland, what thymus gland does in the body? It plays a major role in immune system during our childhood, right? So disorders involving the thymus gland falls under the category of E32 code range. So for example, E32.0, what it is? Persistent hyperplasia of thymus, means the thymus remains enlarged beyond the normal childhood development. You can feel the symptom like difficulty in breathing or the immune dysfunction. So next, coming to the next code, E34, other endocrine disorders. So what are other endocrine disorders? The miscellaneous endocrine disorders that are not included in the above categories other than E30, E31, E32 categories. So other endocrine disorders fall under the category of E34. For example, carcinoid syndrome. So what do you mean by carcinoid syndrome? It's a group of symptoms that occur when a carcinoid tumor, like a type of slow growing neuroendocrine tumor, that releases hormones like serotonin, bradykinin, and also the histamine into the bloodstream. Normally, these hormones are broken down by the liver, but when the tumor spreads to the liver or other organs, the hormones escape into circulation and causes the symptoms. So here you can see the picture of the carcinoid syndrome. What it does show you, this image is a human body diagram highlighting the main organs and symptoms affected by the carcinoid syndrome. So it is a condition caused by carcinoid tumors that releases the hormones, especially serotonin, into the bloodstream. So these hormones circulate throughout the body and produces multiple symptoms across the different systems. So what are the main body areas and symptoms in the picture? You can see over here: heart, liver, gastrointestinal tract, skin, respiratory and retroperitoneal area. So heart, it shows pulmonary and tricuspid wall thickening and stenosis, whereas in respiratory, it shows symptoms like cough, wheezing and dyspnea. Dyspnea is nothing but shortness of the breath. Coming to the skin, cutaneous flushing and apparent cyanosis. So what do you mean by cutaneous flushing? Redness, or you can feel redness or heat sensation on the face and neck. So apparent cyanosis. Cyanosis is nothing but it's a blue discoloration. So why does a blue discoloration takes place in our skin? Due to poor oxygen circulation. So this occur because hormones like serotonin and bradykinin, they dilate the blood vessels. So next, coming to the gastrointestinal tract here, the symptoms include diarrhea, abdominal cramps, nausea and vomiting. These are caused by the overproduction of serotonin in the intestines, increasing gut movement and also the secretion. So liver hepatomegaly. Hepato means liver, megaly means enlargement. So you can see this enlarged liver in the carcinoid syndrome. This liver is the main site where these tumors often spread, releasing more hormones into the circulation. And then coming to this retroperitoneal and pelvic fibrosis. This indicates fibrotic, that is a scar tissue. So this indicates a scar tissue changes in the abdominal areas. In abdominal area, you can see a change in the scar. So this can cause, after when the scar produces, this can cause the pain or obstruction in the intestines or urinary tract. So this is about the carcinoid syndrome. So next, coming to E35 code. Disorders of endocrine glands in diseases classified elsewhere. So endocrine problems that occur as a part of another disease. So whenever these endocrine problems occur as a part of another disease means like cancers or also the infections affecting the glands. So whenever they are affected, this falls under the category of E35. For example, disorders of the thymus in diseases classified elsewhere. So thymus disorder, it caused by another illness like it may be cancer or infection affecting the glands. So disorders of the thymus as a result of the another disease falls under the category of E35. So whenever this type of disorder is diagnosed, so just assign the code E35. Okay, these are the disorders which falls under the code range E30 to E35. Next, coming to the ICD-10-CM code range E40 to E46. So what does this code range includes? Malnutrition. So what is protein calorie malnutrition? It occurs when the body does not get enough protein and calories to meet its need for energy, growth and repair. So this protein calorie malnutrition, it is mostly seen in the children due to inadequate diet, infections or poverty. See, at the right side, you can see the picture of kwashiorkor malnutrition. This is a kind of protein calorie malnutrition, and here is a child, and these are all the symptoms of the kwashiorkor. What you can see over here, swollen abdomen. You can see the abdomen is swollen, and you can see the moon face. You can see the discolored hair over here, and fatty liver, swelling of legs, and also the anemia condition. So E40 code is for kwashiorkor. So what is kwashiorkor? Severe protein deficiency while calorie intake may be normal. So this is common in young children after feeding. So whenever kwashiorkor is diagnosed, just give a E40 code. So E40 code, it's a standalone code. There are no additional subcodes under this category. So next, coming to the E41. Nutritional marasmus. What do you mean by nutritional marasmus? It's a severe deficiency of both protein and calories. So how it appears for us? It appears like extremely thin, wasted body, and you can see no edema. And this nutritional marasmus, it is common in starvation or prolonged food storage. So next, coming to the code E42, marasmic kwashiorkor. So it's a combination of marasmus E41 code and also the E40 kwashiorkor. So combination of E40 and E41 is marasmic kwashiorkor features. So what are the features? Severe wasting pus plus edema. You can also see the edema, that is swelling of legs, and also the wasting, severe wasting. And then coming to E43 code, it's an unspecified severe protein calorie malnutrition. So this is used when malnutrition is severe but the exact type isn't identified. So E44, it's a moderate or mild protein calorie malnutrition. So whenever a mild or moderate protein calorie malnutrition is diagnosed, so just assign the code E44.0. What are the symptoms of this moderate protein calorie malnutrition? You can observe slow growth, fatigue, thinness, mild weakness. So next, coming to the code E45. So what is E45? It's a retarded development following protein calorie malnutrition. So it describes growth delay or learning problems in the children due to the past malnutrition. So E46, it's an unspecified protein calorie malnutrition. It is used whenever the details are not given. General malnutrition diagnosis. So whenever they does not specify what malnutrition it is, so just assign this E46 code. And then next, coming to the next slide, these are other nutritional deficiencies. So this fall under the range, ICD-10-CM code range is E50 to E64. So vitamins are micronutrients needed in small amounts for various body functions. So deficiency of vitamins can cause specific diseases which are classified under the category E50 to E64. So coming to the first one, what it is? Vitamin A deficiency. It falls under category E50. So what is the function of vitamin A? It maintains the healthy vision, skin, and also the immune system. So what is the deficiency causes? You can observe the poor diet, fat malabsorption, and prolonged illness. So here you can see over the picture, these are all the symptoms of the vitamin A deficiency. You can observe the insomnia, so lack of sleep, acne, and also you can experience the dry hair, hyperkeratosis, night blindness. You cannot observe, you cannot have the good vision over the night, fatigue means low energy, and weight loss, so impairment and also the growth impairment. So what is the example of vitamin A deficiency? E50.0. What it is? It's a vitamin A deficiency with xerophthalmic eye disease. So it is nothing but it leads to the dryness and damage of the eye, which can cause the blindness. So next vitamin B1 deficiency. So E51. What is the function of vitamin B1 deficiency? It helps the body to convert the food into energy and it supports the nerve function. So what are the causes? You can observe the poor diet, alcoholism, and also the malabsorption. So next coming to E52, it's a niacin deficiency, or niacin is also called as vitamin B3 and also called as pellagra. So what is the function of vitamin B3? It helps in metabolism and maintaining the healthy skin, nerves, and digestion. So these are, so you do not have any subcodes under the category E52. It's a standalone code. So whenever niacin deficiency is diagnosed, just assign the code E52. So next coming to the next code E53. What it is? Deficiency of other B group vitamins. So this includes other B group vitamins. What are they? Vitamin B6, vitamin B2, and vitamin B2 is nothing but it's a riboflavin. So this causes anemia, skin disorders, and also the nerve problems. So next coming to the code E54, ascorbic acid. It's a vitamin C deficiency. So what is the function of this ascorbic acid? It's important for collagen formation, wound healing, and also the immune defense. So what are the symptoms? Bleeding gums, easy bruising, and fatigue, and also the poor wound healing. And next coming to vitamin D deficiency. So what is vitamin D deficiency? What is the function of vitamin D? It absorbs the body calcium and phosphorus, which helps in maintaining the strong bones and teeth. So this vitamin D, it also supports the immune and nervous system function. So what is the example? E55.0, rickets active. So active rickets. So this active rickets, it's seen mostly in the children due to the lack of vitamin D. Bones become soft and weak, leading to the bowed legs and growth problems. So here you can see in the picture vitamin D deficiency. This affects the, these are the symptoms or these are the effects of the vitamin D deficiency which affect the body system. Brain. You can observe depression in the brain, asthma in the respiratory, high blood pressure and coronary heart disease in circulatory, type 1 diabetes in pancreas, aches and weakness in muscle, rickets and osteoporosis in bone, and also the risk of Crohn's disease, multiple sclerosis, rheumatoid arthritis, cancer, influenza, and tuberculosis in the immune system. So coming to the next slide, E63. So what it is? E63, other nutritional deficiencies. This category, it includes nutrient imbalances not listed under the earlier codes. It covers conditions caused by lack or excess of the specific nutrients. For example, E63.1, what it is? It's an imbalance of nutrient intake. So when it happens, the imbalance of nutrient, so when the body's nutrient consumption is not balanced, for example, too much carbohydrate. So when you have taken too much carbohydrate but low protein, so it gives the imbalance of nutrient intake. So whenever you take excess fat intake but low vitamin imbalance, so this causes the nutritional deficiency. So whenever a nutritional deficiency is assigned, just assign this code E63.1. Now next coming to E64 code, sequela of malnutrition and other nutritional deficiency. What it is? This means sequela is a long-term consequence or after effect of the previous malnutrition. So this, even after correcting malnutrition, the person might still suffer effects such as stunted growth, learning difficulties, and also the organ damage. So whenever the sequela of malnutrition is diagnosed by the patient, assign the code E64. And next, coming to the next session, it is overweight, obesity, and other hyperalimentation. So these codes describe conditions resulting from excessive nutrition. Hyperalimentation, nothing but it's excessive nutrition and the calorie intake, opposite of the malnutrition. Malnutrition, it is low nutrition, whereas hyperalimentation, it's a excessive nutrition. So coming to the examples of this, E65 is localized adiposity. Adiposity is nothing but it's a fat accumulation, right? So fat deposits occur in the specific body areas which are not evenly distributed. For example, fat deposits around the neck or abdomen. So what do you mean by lipomatosis? Lipomatosis, it's a nothing but abnormal or excessive growth of fat tissue in the certain areas of the body. It is not just the one lipoma. You can find multiple lipomas over the areas of the body. So next, E66, overweight and obesity, and E67, other hyperalimentation. E68, it's a sequel of hyperalimentation. And then next, coming to the metabolic disorders. So what are metabolic disorders? So metabolic disorders occur when the body's chemical process which convert food into energy doesn't work properly. These disorders are often genetic, which are caused by missing or defective enzymes that prevent normal metabolism into proteins like carbohydrates or fats. So E70, these disorders or metabolic disorders falls under the ICD-10 code range from E70 to E88. So what does E70 denotes? It disorders of aromatic amino acid metabolism. Aromatic amino acids. What do you mean by aromatic amino acids? So this include phenylalanine, tyrosine, and tryptophan. So when these are not properly broken down, harmful substances accumulate in the body. For example, E70.0, classical phenylketonuria. So what do you mean by PKU? It's a genetic disorder in which the body cannot break down the amino acid phenylalanine because of the deficiency of the enzyme. So as a result, phenylalanine, it builds up in the blood and brain, causing the brain damage. So whenever it damages the brain, this classical phenylketonuria gets diagnosed. So E70.0 code must be assigned for the PKU disorder. And then next, coming to E71, it's a disorders of branched chain amino acid metabolism and fatty acid metabolism. E72, other disorders of amino acid metabolism. E73, lactose intolerance. So what do you mean by lactose intolerance? It is a deficiency of the enzyme lactase, so which digests. So what does this lactase enzyme do? It digests the milk sugar, right? It digests the milk sugar, it converts the lactose into lactase. So for example, E73.0. Here it's a congenital lactase deficiency. I said congenital means it is present by birth itself. So babies are born unable to digest milk. So that condition is called as congenital lactase deficiency. So whenever the congenital lactase deficiency is diagnosed by the patient, you just assign the code E73.0. So next, E75 code, it's a disorders of lipid metabolism and other lipid storage disorders. So for example, GM2 gangliosidosis. So and the next, E76, E77, E78, E79 and E80. So what does this codes determine? As a disorders of glycosaminoglycan metabolism, the disorders of glycoprotein metabolism, disorders of the lipoprotein metabolism, disorders of the purine and pyrimidine metabolism, and disorders of the porphyrin and bilirubin metabolism. So these are all the metabolisms related to the deficiency of the enzymes, right? So deficiencies of the enzymes, deficiency of the mucopolysaccharides falls under the category from E76 to E80. And coming to the next slide, E83. So what do you mean by E83? Disorders of the mineral metabolism. So these are the diseases where the body cannot regulate minerals properly. So what minerals? Such as copper, calcium, phosphorus, iron or magnesium. So these minerals are essential for bones, right? So the minerals which are essential for bones, blood, nerves and muscles, these minerals cannot be produced by the body. So that disorders of mineral metabolism are listed over E83 code. For example, Wilson's disease. So what do you mean by Wilson's disease? It's when copper builds up in liver, brain and eyes. It causes liver damage, neurological symptoms and also the golden brown eye rings. So E83, it's nothing but it's a mineral imbalance. Too much or too little of metals like copper can damage the organs. And coming to the E84, it's a cystic fibrosis. For example, E84.1, cystic fibrosis with intestinal manifestations. So you can also, it's a combination with intestinal manifestation, like related, the disorders related to intestine, it is combined with the cystic fibrosis. It's a genetic disorder affecting the glands that produce the mucus, sweat and digestive juices. So whenever cystic fibrosis, whenever the patient is diagnosed with cystic fibrosis, E84 must be assigned. So next to the cystic fibrosis, you can find E85, which is amyloidosis. So this is the condition where abnormal proteins called amyloid. So amyloid is a protein which build up in organs like the heart, kidneys or nerves. So these deposits interfere with normal organ function. For example, E85.0, non-neuropathic heredofamilial amyloidosis. So it's an inherited type affecting the organs but not the nerves. Right? It's a type 2 one, type 2 polyneuropathy. And E86, volume depletion. Volume depletion is nothing but the body has lost too much water or fluid. So whenever the body gets loose of too much water or fluid, it results in a condition called dehydration. So dehydration is assigned as code E86.0. This dehydration, it results in dry skin, low blood pressure, dizziness and the kidney problems. So next, coming to the code E87. What it denotes? Other disorders of fluid, electrolyte and acid-base balance. For example, E87.0, hyperosmolality and or hypernatremia. So these disorders occur when sodium, potassium or acid levels in the body are out of the balance. So the body fluids and the salt systems are essential for nerve and muscle function. So E87.0, it is assigned whenever hyperosmolality is diagnosed. Hyperosmolality is nothing but body fluids too concentrated. So whenever the fluids are too concentrated, hyperosmolality is diagnosed. Hypernatremia, it is nothing but too much sodium in the blood. It's a result of dehydration of the loss. So the last code E88, other and unspecified metabolic disorder. So this E88, it's used for metabolic conditions which are not covered by the other codes. These often involve abnormal fat storage or processing. For example, E88.1, what it is? Lipodystrophy. So what is lipodystrophy? It's an abnormal or absent fat tissue. This may be generalized like whole body or one area. So this can cause insulin resistance and diabetes-like symptoms. So whenever a patient gets diagnosed with lipodystrophy, just assign the code E88.1. Yeah, that's it for today's session, guys. In the next session, you will be learning about the CPT coding classification of endocrine diseases. Thank you.